Okay, the whole area of medication for service users is a really important one, and it's one where we can make a real difference to someone's day-to-day general health. There are 3 types of support we might be asked to provide: self-managed medication, assistance with medication, and managed medication. Where a service user self-manages their own medication, we have no role to play. The service user will understand how and when to take this medication. However, if you are asked to call the pharmacy and order a repeat prescription or asked to pick up a prescription, then you can do this if the care plan allows for it. If a service user requires assistance with their medication, your job is to remind them at the times they need to take this medication. This is a really important responsibility and one that is included in care plans. If asked by the service user, you can also help opening bottles, taking pills or tablets out of blister packs, a Dosset box or a compliance aid, and dissolving medication in water before consumption. Of course, it's really important that the service user has capacity to ask you for this help. Where someone does not have the capacity to take their medication, then they may need managed medication support. This is done from original packaged medications, and you must complete a medication administration record, or MAR chart, each time medicines are administered. This service must be assessed and set up by joint partners from social work services, the NHS, and Cordia, so it's important for your safety that the care plan includes administration of medications and that you have been trained appropriately. Not all medications are appropriate to be administered by a carer, and this is why it is important that managed medication is assessed as part of a medication review. Big no-nos include inserting suppositories or a pessary, administering oxygen, changing oxygen cylinders, administering nebulizers, and administering some controlled drugs like morphine. If you are in any doubt about what you can and cannot do, then contact your coordinator for help and support in the first instance. For those service users receiving managed medication, your responsibilities are critical. You should only be carrying out this support if you have received the appropriate training. Make sure you study the MAR chart carefully, ensuring you familiarise yourself with medications, labels, and the dosage and times medication should be given. It is your responsibility to administer medication and to ensure that it has been consumed appropriately. Each time you do this, record the activity on a MAR chart and add any notes you think might be appropriate. For example, if a service user is finding it difficult to take any of their medication. When managing someone's medication, it is vitally important that you read the labels of all medications. Check the name and address on each box or bottle. Check and understand dosage instructions. Check for any advice or warnings about the medication, such as the possibility of it causing drowsiness, and advise the service users of this important information. Also, make sure you follow storage instructions appropriately. In some cases, this may include storage in a refrigerator or in a cool, dry place. Remember to check expiry dates on medication and never administer anything that is out of date. No matter what level of service you provide, dealing with someone's medication is a big responsibility. If you have any concerns, then it's really important that you contact your coordinator. It is always better to check and get advice than make a mistake. If you do make any mistakes when administering medication, then contact your coordinator or area operations manager immediately. You may also contact your local community pharmacist, service user's GP, or NHS 24.